It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Thanks for joining us, folks. So, my friends, everyone is concerned, nervous, and worried about COVID-19, and you should be. However, today we want to talk about the emergency room and the ER up here at the Lehigh Valley Hospital. We are talking about safety, and we're talking about the fact that you should not have any fears of coming up to the emergency room, especially those people who are suffering from maybe pains in their chest or et cetera, and they're afraid to come up. But so we figured we'd put everything to ease today. We have the main people involved up here in Lehigh Valley Hospital. We have we have John Fletcher, who is the president. We have Dr. Miller, who is the vice chair of emergency medicine, and we have Dr. Valente, who is the medical director. So let's try to put the fears aside and talk about what's happening, and also where are we going from here. All we could say is that congratulations to all the people that are working here at Lehigh Valley Health Network in the Hazleton Hospital. They've done a fabulous job. Mr. Fletcher, how are you?
I'm doing great. How are you?
You look fabulous.
Thank you. Thank you. I got my hair cut. And
yes,
we're in good shape.
People like you have no problem, but guys, I got locks and everything.
I have no problem.
You know, this has been a challenging time for everybody.
Mm-hmm.
You know, it's a whole different world for a lot of people, particularly seniors. They're fearful. There's a lot of things happening. So give us an update of where we are today with COVID-19.
So, I'm pleased to tell you we're in pretty good shape. And if you remember when we first had a conversation, we talked about Hazleton got hit hard. And at the end of March and early April, we had over 100 positive cases coming through our testing centers on a daily basis. And so we were considered a hot spot. But I must say that we got the message out, thanks to you and to many others, about stay home, stay safe, please social distance. We worked very closely with our community leadership. We worked with the industrial plants. We talked to them and had many conversations about the need to social distance, the need to get control over what's happening with COVID-19 in the Hazleton area. And the community responded. And so I want to say thank you to the community for listening to our message and doing the right thing. And so when we hit our peak, and on the inpatient side, we were having an inpatient census of over 30 positive COVID patients with a very busy ICU as well. So we were hit hard. We're down. I can tell you that as of today, we have 0 COVID positive patients on the med-surg floor. We do have 2 in the ICU, 2, from in the 30s to 2. The number of positive tests from our testing centers yesterday, we had 1 positive. And so what we're seeing is from over 100 plus, to 1 yesterday, all single digits within the last couple of days. And so what we're seeing in Hazleton is because of what everyone did and took this thing as seriously as we needed to, we're in a good position. But what got us into trouble can still get us into trouble. And that is by not social distancing, by not wearing masks when you're out, by not washing your hands. The last thing we want to see is any increase. And so I know we are beginning to open up. And so I just want to make sure that the community is well aware that as we open up and as we get out, to make sure that when you're out, do the social distancing, wear your mask, wash your hands, do everything that you did before to get us to this point, because we don't want to go back. And I think it's important that we all work together on that.
So without the vaccine, that hopefully we would get someday, you're still maintaining the safety part of the COVID-19, okay? So now, you said the fact that we're down to 0, this gets people excited and they feel good about that. So
right.
we can feel good, but we still have to be careful, as you're saying.
Absolutely, we can feel good.
What steps then are we taking here at Lehigh Valley Hospital?
So one of the things that we've seen, and what we want to talk about today, is specifically about our emergency department, but as well as the other service areas. We are now doing surgeries. in the hospital. Our Lehigh Valley Physician Group practices are now open. Our outpatient testing, whether that's rehab or imaging, are open. The emergency department has, there was a rumor out there that we were closed, the emergency department. Never closed, and we are open. But in the emergency department, what we've seen is a significant decrease in the number of patients coming to the emergency department. And I think part of that was early on, that people were fearful of coming to the hospital. And I think that still exists today. But what I want people to understand, and we're going to show you, what we've done to make the hospital and our outpatient centers, as well as our practices, our physician practices, COVID safe. And so we've taken extra measures to make sure that when a patient comes to us, that we have done everything possible, from the cleaning of the facilities, to checking temperatures when they enter, to wearing a mask, to making sure in the practices that limited separated waiting areas and very limited time in the waiting areas, if at all, that we are taking care of them, and it is safe. It is absolutely safe to come to our emergency department, to come to the hospital, and to come to our outpatient centers and our physician practices.
Okay, with that being said, you have people coming. We got our temperatures checked before we came in, which is great. Assuming there is a person who has a mild high temperature, are they allowed to come into the hospital?
There are certain parameters that if they hit a certain temperature, that they are not allowed to come into the hospital. That's to protect them. What we will do is we will give them directions as to what we need to do next. So if you come in and your temperature is over 100 degrees, then we will talk to you about we need to make sure that we're taking care of it. We're just not turning you away.
Okay.
We're also working with you to say, what do we do next?
Okay. Are you providing masks?
Absolutely.
Okay. So sometimes people are emergency room, they don't have a mask, and so you're providing all. We're
providing masks. We prefer that if they come in with a mask, that would be great. But if they don't have a mask, we will supply.
All right. So you are right about the fact that people are fearful, because when I told them I was coming up here to do an interview, oh my God, you're going to the hospital.
Yeah.
So I'm going to the hospital. It's fine if they're doing a fabulous job. So there's that fear out there. We want to get rid of the fear. So you're president of a hospital, okay? You're in contact with a lot of people throughout the state of Pennsylvania. There's a lot of questions out there today. We don't know whether numbers are true, whether they're, people are, it's, politics is, and all this stuff. Let's deal with facts. So as you people have to deal with facts, okay? Where are we today in terms of, in the state, where are we in terms of how much we can get our lives back?
Yeah, so I'll be honest. I mean, I think what we just shared with you about the numbers specifically in Hazleton, I think we're also seeing that regionally. I am in touch with the leadership from Geisinger, and we have a Luzerne County committee that talks to healthcare providers, and we're all seeing the same trends. We're all seeing the decrease in the number of admissions. I think it's interesting because Dr. Valente and I have had this conversation many times, that even though when our positives were up, we were seeing, we still weren't seeing those admissions. And so I truly think that the most important number is how many people are being admitted. And so although we had a high number of positives at one point, people got well. They got better. And so now we're down to single digits.
Yes.
And so we're seeing that in the region as well. And throughout Luzerne County, and I believe throughout the state as well, we're seeing that decrease.
So when they opened the testing unit at the Mohegan Sun, okay, were there an abundance of people getting tested there? Or same as you had 2 testing areas up there, right?
We had 2 testing areas here.
And how were you getting inundated with people coming in getting tested?
Well, early on we were, and if you recall, when we first had it opened, 2 testing centers, we were getting hit hard at the end of March and early April with the number of people being tested. We had to change the criteria because of our testing supplies. As soon as we got more testing supplies, we opened it up, and we have not seen an increase in the number of people tested. And so I think what we've seen is early on we did a really good job at testing people. We tested a lot of our community members. And then as we progressed, the community, when they needed to be tested, they were tested. But we didn't see that extreme need that we saw early on.
So tests were available?
Tests were available.
If you wanted to test, you were able to get the test.
That's correct.
All right. So before we bring Dr. Miller on and talk about ER, which I have to tell you, I mean, and Yeah, I know you a long time. I know most of the doctors up here. Everyone up here has been so fabulous. I mean, even at the Health and Wellness Center, when you go to different areas, the doctors have been great, and the receptionists, and you got a lot to be proud of, John. I mean that sincerely. They're doing a fabulous job. Everybody.
And I am very proud. I'm very proud of the community and their response. But I'm also extremely proud of our staff and our providers because they stepped up.
Oh, yeah.
I'll tell you that during the peak period, it was pretty tense.
Oh.
But nobody blinked. Yeah. We did what we had to do. They did what they have to do, and that is both our direct caregivers, but let's not forget all the others. You know, let's not forget the housekeeping staff. Let's not forget the maintenance staff. Let's not forget all of the people that support. Not one department hesitated, and I think that shows a lot about our commitment and about the people that we have working here, and I couldn't be prouder of them.
No question. The whole network, Lehigh Valley
Absolutely.
Health Network, has been absolutely fabulous. Anything in closing before we bring the two professionals on? I mean, you know, Valente is going to be pretty difficult, but I'll get by it.
Well, good luck with that.
Yeah, okay.
I have to work with
Miller's
him every
no
day.
problem.
Miller's, he's pretty easy guy.
Valente's the problem.
He's the problem.
So anything in closing you'd like to tell me?
Just a huge thank you. I mean, truly, I think a huge thank you to the community for listening and doing what they needed to do, but also a message to them that don't let your guard down. We're going to be out more. We should be out more. We are a COVID-safe environment at the hospital and as well as in the outpatient center. But please, when you're going out, wear your mask, do the social distancing, wash your hands, because if we don't, there's that possibility that we could see a spike, and that's the last thing.
We don't want that.
We don't want that.
With that. Folks, I'm talking to John Fletcher, who is the president here at Lehigh Valley Hospital Hazleton. It's safe. It's safe, folks. I know when I mentioned I'm coming up to interview Fletcher and Valente and Miller, everyone's, are you going to the hospital? Yes, and let me tell you, it's very safe. Don't stay home, and if not feeling well, get up here to the hospital. We come back, we'll talk to Dr. Miller, doing a great job up here, and as well as Dr. Valente. We'll be back right after these messages. Welcome back to the Sam Lesante Show, folks. Remember, 24/7, all of our shows, ssptv.com, on Comcast 190 in Pottsville, 7 to 11 every day, and also in the Wilkes-Barre Mountaintop, Kingston area on Channel 92 Saturdays and Sundays, 7 to 11 p.m. We're here at the Lehigh Valley Hospital Hazleton, and we're talking about COVID-19, how safe it is up here, folks. So we figured we'd bring the heavy hitters in. Mr. Fletcher was on, who is the president. We are now going to talk to Dr. Andrew Miller, who is the vice chairman of emergency medicine here, doing a great job. Dr. Miller, nice to see you again.
Oh, nice to see you. Thank you.
So, you know, we always kid you about you looking like a kid, you know. I mean, I hate you for that, and you have all that hair, and I have hardly any hair.
Yeah, you look good. It's moisturizer. I don't know.
Not bad for 47 years old, huh?
Exactly.
Boy, do I lie a lot. Hey, doctor, first of all, I got to congratulate you. You're really doing a great job. But let's talk about, you know, why some people who are ill, okay, have severe symptoms and still are concerned about coming up.
Yeah, no, I mean, thanks for asking, because what we've seen over the last couple of months are probably 40% of people that should be coming up for an emergency haven't been coming. Whether it's chest pain, having a heart attack, weakness, or paralysis from a stroke, people are delaying care. And for reasons that I think we kind of expect. I talk to people when they come in, they've had chest pain for 3 days, and I'm like, why haven't you come up sooner? Because I know probably a couple months ago you would have come up. And the two things they share with me is, one, they were scared, maybe COVID, and they didn't know how, you know, what the facility would be able to kind of handle. But the other thing is they apologize for coming in because they think I'm so busy taking care of people with COVID that they don't want to take up my time with a little bit of chest pain. So I think it's important for people to know that we've seen an increase in stroke, we've seen an increase in heart attacks, and delaying care has been an issue.
Which, you know, are some of the symptoms that you're seeing, because, you know, you have the other side of people staying home, not going out, panicking, and a lot of concerns. Are some of those concerns from the fact that people are home and they're just getting crazy a little bit. We want to get out and, are they getting anxiety fears or?
As far as coming in, you mean?
Yeah.
Or well, I think that it's in some ways the opposite. I think people are sitting home and they're anxious about a couple different things, and so they're trying to make decisions on whether they come in or don't come in. And I just don't want people to overthink it. I'd rather just have you come in, if you have any of those symptoms.
What about some of the changes in the process that your team has made in the Lehigh Valley Hospital here?
Yeah, absolutely. I mean, the new emergency department that we've just put into play has really been very useful. And so when visitors or patients come in, the first thing is they're screened, including all of our employees. And so just to make sure there's no fever, no signs of COVID or anything like that. We follow all the CDC recommendations as far as masks. You'll see our staff in masks. You'll see hand washing up to 2 minutes, and all of the socially distancing that we can do. We've definitely put into play. Even in the waiting room. When you come into the waiting room, you'll see our pivot nurse who will be able to do our quick triage. But even the waiting room, we've cohorted patients, so we have a kind of a COVID section, a non-COVID section, and even socially distant chairs in the waiting room if you have to wait. We try not to have anybody wait, and to get people through the system as quick as possible, and able to treat them, in an efficiently way.
You did some physical changes as well.
Physical changes, yeah. So what you'll see in the ER, is we put up walls. So we put up physical barriers to try to minimize any kind of exposure that somebody might get should they come in. In addition, even the waiting room chairs have been spread out, and we kind of socially distant that way as well.
How do you treat a person who has COVID-19?
So the initial treatment is supportive care. So we'll give them oxygen if they need to. We'll give them fluids. We'll take lab work, and we'll just assess them on doing chest X-rays and things like this based on what they need. So it's always case by case specific. So it's hard to kind of answer that on any individual basis, or general basis. But I think that the care has been superb. I mean, I've really been excited. Our team's put together great protocols. Following national guidelines as well as developed ours within the Lehigh Valley Hospital and Health Network. And so the treatment has been really, really good.
There's been some people that have COVID-19 that didn't know they had it. Is that true?
Oh, there's absolutely asymptomatic patients out there. Yeah. I don't know the exact numbers for any specific population, but generally speaking, I think we'll see, if we start doing a lot more antibody testing, for instance, I think we'll see quite a few people that have had it and didn't even know that they had it.
Is that right? So you're a busy person, and I got to tell you, seriously, you're doing a great job.
Thank you.
We're very proud of you, okay? What is the most important message you'd like to send to the community?
Well, there's no doubt that I really want people to not delay in getting their care. Don't overthink it. Don't worry. The ER is safe. I mean, it is safe for us to take care of you. We have all the barriers in place. Anything that we need, anything that you come in, we can take care of, whether it's low acuity, high acuity, COVID, non-COVID. We're here 24/7, 365.
Doctor, nice talking to you again.
Thank you.
Good luck to you, folks. Since 1994, I've been saying about our local health doctors and people who participate, and it just gets better and better. So very proud to have Lehigh Valley Health Network involved in doing a great job. Excuse me, we'll be back after this. Welcome back to the Sam Lesante Show, folks. I'm here at Lehigh Valley Hospital in Hazleton. We talked to John Fletcher, who's the president. We also talked to Dr. Miller in the emergency medicine department. Now we'll talk to Dr. Valente, who is the medical director. So before I get into asking some questions about LEAPFROG, is the ER overwhelmed with COVID patients?
No. The short answer is no, Sam. There was a time where, yes, in fact, they probably were. If we go back to late March, early April, where we saw the real spike here in town. But currently, knock on wood, the short answer is no. We're doing fine. They are definitely not overwhelmed with COVID patients.
Good. Now, recently, Lehigh Valley Hospital Hazleton received another A on its report card. LEAPFROG Spring A rating. What is LEAPFROG?
Okay, it's a little, I'll try to give you a concise answer if I can. LEAPFROG is a consortium of it was put together many years ago, probably 20 or 30 years ago, by big business industries that were purchasers of healthcare services. And they put together a consortium, so to speak, where they graded hospitals, facilities, healthcare networks based on how much value was provided by a given organization for a healthcare dollar. And a big part of that is patient safety. So LEAPFROG these days is viewed as a real guide to patient safety. How safe is it when I come to a hospital? What is their mortality rating like? What is their hospital infection rating like? And so when you see a grade, it grades you in comparison to all other hospitals in the country. So as you notice, we've gotten an A grade. And what's really nice about getting an A grade is that you're being compared to everybody on the same playing field, but regardless of the size of the facility. So that A grade is not just for small community hospitals. That's an A grade across the board, which is really nice, and we're very proud of that.
So what does that mean then to the community?
What that means to the community, it means that the quality of our hospital is rated A in comparison with all the other hospitals in the country according to LEAPFROG. It's just that simple. Our mortality, as I mentioned, our patient safety scores with hospital-acquired infections, all sorts of things. There's many parameters, obviously too numerous to list right here, but many parameters that go into a LEAPFROG grade. It's a time-consuming process to put together all the information that they ask, and then and they put that all together, and then you are graded on kind of a continuum with all the other hospitals.
And this is something that is independent. This is you don't belong to a club or
Absolutely
pay a
not.
fee or
Correct.
It's just completely independent.
Absolutely, and it was actually put together for the right reasons. It was put together for just this purpose.
So let me ask you something, Tony. How many years have you been practicing?
30.
Have you ever seen anything like this in your experiences with the COVID-19 in the last 3-4 months?
Again, the short answer is no, nowhere near this. I have not seen the degree of illness. This disease is in a class of its own. I do critical care medicine, as you probably know, and so I take care of the folks when they're in the ICU. And I have never seen lung injuries like what this virus can do. It's horrendous, is the only word. What it does to people young, old. Obviously, older folks are more at risk for it. But
why is that?
Well, older folks are more at risk for everything, but older folks tend to have the classic comorbidities that we discussed: hypertension, obesity, diabetes. And comorbid conditions, asthma, COPD, heart disease, things of that nature. But young people aren't immune of it. The average age in a lot of ICUs is actually in the high 50s and early 60s.
Wow.
It's not in the 70s and 80s like you would think.
Yeah. So as John Fletcher said about maintaining, the mask, washing, the social distancing, until we get a vaccine, I would assume. Is that where you communicate the same thing?
Absolutely, Sam. You'll see different figures everywhere, and with this, and to some degree, it's not anybody's fault that the figures are different, because to be truthful, we're learning as we go. Yeah. This has never been done before.
That's right.
There's no information on this. We're accumulating data, but I've seen figures as high as 75% reduction in the ability to transmit this disease if everybody wears a mask.
Yeah.
And so it can be very promising, if we just do the right thing. And I heard John mention some things earlier on in your talk with him, and he said all the right stuff. We can open up. We don't have to keep businesses closed. We don't have to do all the things we did initially. But what we do have to do in a smart way now. We can't do business as usual, but we can do business.
Before I wrap it up, do you think the vaccine will eliminate a lot of concerns?
The vaccine will eliminate a lot of the concern. What we don't know about the vaccine is how effective it will be. And Sam, one thing about the vaccine too is you don't have to vaccinate everybody. For a vaccine to be effective, you typically have to vaccinate about half the population. If you get half the population vaccinated and immune from the disease, and you have the other portion of the population that has already had the disease and is immune, you get what's called herd immunity. And the virus doesn't have enough people out there to continue to be transmitted. So not everybody has to get vaccinated. It's typically about 50%.
In closing, to wrap it up, okay, can you give us an update on the COVID-19 screening processes, just in case someone may feel they have symptoms?
Sure. Sam, they haven't changed all that much. It's the same that we've stressed before. It's fever, it's muscle aches, obviously if you've been in contact with somebody that has tested positive, but it's the same thing. If you have any indication that you have an illness, what we would call a cold symptoms, they're the same, cough, sore throat, fever, get tested. It's very simple. There's plenty of tests around these days. get tested and do the right thing once you are tested.
Tony, keep up the good work.
Thank you.
And
Appreciate
the
it.
whole
We
crew
will.
up
Don't
here.
worry.
Yeah, keep up the good work. He's a lot older than me, folks, but he knows what he's doing. We are very happy to have John Fletcher here on today, and Dr. Valente, and also Dr. Miller. All I can say, folks, it's safe. It's 100% safe. And if you have any symptoms, do not be afraid to come to the hospital. You'll be in excellent care. We'll see you next time.